All right, thank you for staying with the Monday Report. The town hall session begins right now. Let me introduce my guest, beginning from my farthest right. Benjamin Mushiri is here. He's a senior manager at the Macroeconomic Statistics at the KNBS. That is the Kenya National Bureau of Statistics. Thank you so much for making time. Vivian Nyarunda is next. She is a senior manager, production statistics at KNBS as well. Thank you so much for making time. And last but not least, MacDonald Obudo is the Director General, Kenya National Bureau of Statistics. We're going to talk about the Kenya Demographic and Health Survey. If you're wondering how this is done, watch this.
Developing countries have issues with population growth, ailing economy, health hurdles, among others.
We are not very stable when it comes to health-related matters. We are not able also to, we are also not very okay when it comes to controlling our fertility levels.
To plan for, develop policies and implement them for a healthy population, a survey needs to be done to yield actionable recommendations for various policymakers. KNBS is mandated by the law to undertake surveys, currently doing DHS, aimed at gathering data that will draw recommendations for the health sector in issues surrounding fertility levels, contraceptive prevalence, child and maternal health, domestic violence, non-communicable diseases, and other health issues.
DHS survey is a specialist demographic survey that is conducted to provide up-to-date socio-demographic and health indicators that are used for planning and measuring achievements in the health sector.
This process begins with identifying key indicators, setting up and preparing teams, deploying them to the field for survey, whose resulting data is analyzed, conclusions drawn, and recommendations made to the relevant policymakers.
We conducted the training in January. After the training in January, we embarked on now field work from 17th of February. Up to date now, we have been doing field work data collection, and it's expected to end by mid-July.
We follow the right procedures. I also make sure that they finish their interviews on time, and they complete all the interviews that have been assigned to us. And I also conduct spot check re-interviews. I do this so that we maintain the quality of data.
Our recommendations are actually based on the results that we are getting against the standard norms of what you would expect of an indicator. If it is higher than normal, you would alert the policymakers that here there is an issue which we need to deal with. From there then, we now leave it to the policymakers to deal with their bit.
Results of the preceding surveys translated to policies have seen infant mortality rates decrease, maternal health and uptake of contraceptives improve in the country to prevent population explosion in the future with scarcity of resources.
We have had the total fertility rate well controlled, because that it means then even the level of family planning, the way people are taking it, is making a lot of sense, and of course the policies that are designed around the figures that we've been getting.
Moving forward, KNBS looks forward to carrying out surveys that not only bear workable data but also help improve the well-being of each individual Kenyan.
We want to see what is the situation of stunting, what is the situation of underweight. When you take salt, what amount of iodine do you have in that salt, so that you can trace it to even the manufacturers, because you know you'd want to have a healthy diet, you want to have everything put in the right proportion, and so we have also, it has been noted that the amount of iodine in food at times, in salt, at times it can be very high or low.
All right, and that's a conversation we're delving deeper into right now. And DG, let me start with you. Whoever is sitting at home now is wondering, what does the Demographic and Health Survey really reveal? What is it meant to achieve in simple terms?
Now, the Demographic and Health Survey is actually first done in developing countries where there are major health issues. and the population structure is also a concern. And so it is meant to bring out the health of mothers and children, particularly the women of reproductive age, that is the age of 15 to 49, and then children. The main concern is about those who are within the age of, those who are under 5 years of age, and it is meant to help us get to know our demographic arrangement in the country, so that it is possible for the country or the government to plan for its people. Other than the element of planning and the design of policies, we also use the statistics that are generated from the Demographic and Health Survey to monitor the programs and projects that are ongoing, so that we get to know the impact of the policies that the government has come up with.
Yeah. And let me bring in Mushiri on this. Mushiri, what has been the most startling findings during this period of trying to come up with the Kenya Demographic and Health Survey? Because I know the last time one was done was in 2014, right? It's supposed to be done after every 5 years, but because of COVID-19, you couldn't do it. What has been the most startling findings from your side?
I think at the moment the survey is still ongoing, and therefore we have not reached that stage of doing the analysis.
But previously, if you compare, what were the issues that were there then and what you expect now?
Yeah, maybe I can come in and say something on that. When we did the last one in 2014, we are able to compare the situation that has been since 1989. The first demographic and health survey that was done was in 1989. And so after every 5 years we undertake one. So 89, 93, 98, 2003, 2018, 19, 2014. And so in all this series that we have done, we have noted that the total fertility rate of women in Kenya is actually going down. If I could just go back a bit, before 1989 DHS, we had what we call Kenya Fertility Survey that was done in 1978. It revealed that the total fertility rate for Kenya was 8.1. That is the number of children that a woman within the reproductive age can bear during that period. That is the average. That was the average in Kenya. So it was 8.1. But then in 1989, when the next one, the first DHS was done, it was 6.1. And then we noted that over a period, it has actually been coming down to the last one, which was 2014, and we got total fertility rate being 3.9. That is now that is a figure that was now lower than the previous one, which was in the year 2018-2019, and we had 4.6. Before that, we had 4.9. So we have noted a trend where our total fertility rate is actually going down. Something that is actually very, very useful to the nation, because then we are trying to control our population by giving birth in a manner that tends to get to the normal.
Do we know why?
Yes, first, we have a lot of programs on family planning. Yeah. And so there's a lot of advocacy on that. And then, as the Kenyan population is getting more educated, uptake of or understanding of the policies that the government is coming with, the policies that our government are coming up with, it is easier now to understand them and to practice. So over the period, and there's also the use of the contraceptives, which then helps also in reduction of the number of births that women in Kenya are having. Yeah.
And Vivian, in your department, what has been some of the highlights that you've seen over time in terms of the trends, of the changes over time of what you've done so far in Kenya Demographic and Health Survey?
I think just to follow up on what the DG has said, and looking at specifically issues of fertility. Yeah. Fertility has actually gone down courtesy of more women are more educated now. There's delayed childbearing. There's delayed marriage, which is really a risk in terms of giving birth. And in the other area, we are looking at child health. There's improved child health. More women are going to the clinics for antenatal care. More women are going to the clinics for postnatal care. And we're also seeing declining child mortality, both infant and under 5 mortality over the period. And as we wait for the results of the 2022 DHS, we are expecting that we are going to get even better results.
Yeah.
Yes.
This sounds to me like it's almost intentional when you say there's delayed childbearing because the people are more sophisticated and educated now. Is it so much a health issue, or it's an intentional decision by the majority of the population?
A lot of times it's an intentional decision.
Okay.
Yes, because women are now more empowered, they make decisions.
Okay.
Yeah.
Mushiri, what is the relationship between population and the economy?
There is a very big relationship between the two, because human beings are part of what you call factors of production. Because the more the population, the more the number of people, the number of employees. But then there are so many other things that need to be right, because you hear people say that we don't have jobs. So there is a relationship, especially if all the environment is right.
Yeah.
Yes, there should be a direct relationship between the two.
In the business news that I just did a few moments ago, there's a projection that Kenya's economy is set to slow down by 4.9% for the year ending June 30th this year. Is that accurate from where you stand?
I'm not in a position to say whether it's accurate or not, because we shall be doing the first quarter GDP release at the end of this month.
Yeah.
And I think it would be preemptive for me to give the information when we are not yet there. At the moment, we are actually doing the collection of the data that we need to use for the compilation of the first quarter GDP. So, and I think it's also good for me to mention that at the Bureau of Statistics, we are basically not doing forecasting. So there are those institutions that are in charge of doing forecasting, and therefore they do the econometrics, and probably so I'm not in a position to say yes or no.
So you deal with real time, you don't predict and say
we don't do projections.
Okay.
Yes.
Ours is data driven.
Yeah.
So until we have that data, until we confirm the completeness of that data, until we confirm the accuracy of the data, it becomes very difficult to forecast.
Yeah. Okay. Yeah. Let's talk apart from fertility. Let's talk about domestic violence. Is that a factor that has been looked at as a parameter? What are the indicators, DG, just so that people understand properly? These are the things you're looking at.
Yeah. First, the domestic violence. In the DHS series, we used to cover only violence against females until 2014, that we introduced violence against male. And so in 2014, the violence against female was 38.6%, while that of violence against males was 8.6%. So you can tell that women have more of that problem than males. But over the period, of course, even this time round, in the forthcoming results of the DHS, we'll also have the two, so it will be easier to compare. But previously, it was only one-sided. It was only done against violence against women. But it has also been going down. We expect to see what is happening in the next one. For males, we cannot tell because we only did it once and it was over 8%, 8.6%. So we are eager to see how the trend will be once this survey is completed.
Yeah.
By the way, I think it is also necessary, Trevor, to mention that the 2022 Kenya Demographic and Health Survey that we are talking about is actually a process that is ongoing. We started it on 17th of February this year. That is after training of 28 days. Then we went to the field. So we are meant to do it for like 5 months.
Yeah.
So come mid next month, we would expect the last teams to be getting out of the field. So then it will now give us room to start doing analysis. So it is a process that is actually ongoing.
Yeah.
But then we are able to mention a few of what was done previously.
Yeah.
Yes. So the main one that is going to give us the actual situation as it is today is what is ongoing in the field.
Yeah. But Vivian, even though it's ongoing on the field, like the DG is saying, but are there some interesting new things that you're seeing that were not there previously? Because this was done almost 8 years ago. In the middle here, we had an entire session of COVID-19, almost 2 years, where so many things were exacerbated, things that people did not foresee. Economic pressures came by, mental health came by. Are there certain things you're seeing that were not the norm back then?
I believe that will come out once we do the analysis of the...
I like the way KNBS wants to talk about the statistics at the end. You don't want to preempt anything.
Yes.
Go ahead, Vivian.
However, I know that during the COVID-19 period, we had some studies that were undertaken on impact of COVID, COVID-19 on households. Of course, then there are some of those statistics that might have come in then. Yeah, but for the DHS, we are yet to get the results, which will be out as soon as we've analyzed the data. Okay. Hopefully by the end of the year.
Yeah, DJC, you want to
I think I can add on something there. You know, as now that you're talking of anything that might have happened in between, we, like what Vivian is talking about of COVID-19, we added a question that is trying to establish the extent of vaccination, so that we are able to compare with what has been recorded by the Ministry of Health. Remember, much of the data that we are actually generating is going to be used by Ministry of Health. That is the major user of the information that we are generating. And so we are happy to have had that question, so that we are able to see what the administrative data is talking about and what the survey data is giving from the survey perspective of it. And so any changes that have occurred in the recent past, we are really keen to introduce them in our subsequent surveys. So DHS is already taking care of vaccination. We have also introduced the element of disability, which was not part of that before. So when we are going to disaggregate our statistics, then there'll be a chance now to see the situation of those with disability and those without. How is it playing out in terms of the indicators that the DHS is getting? So that's a new thing that we are doing. The other one is on non-communicable diseases. Here we are looking at the issue of the cancer. We have the breast cancer, we have the cervical cancer, we have the prostate cancer, then we have the hypertension, we have the diabetes, and a number of these diseases that are not communicable. Yes, including accidents. That is also part of what we are checking on. So much as we did it in 2014, we now want to see the trend of those years down the line. What is the situation now? So I would say that checking on the indicators on non-communicable diseases is also something that is relatively new, and so it is within our interest to ensure that if there are major changes that we have noted in the population, and it is an indicator that we have not measured before, or it is a variable that will be able to help us calculate indicators that we have not done before, we happily introduce them, but of course with some care, because again you do not want to overload the questionnaire, which then would also bring about fatigue to the respondents.
I'd like to hear from all of you, what are some of the recommendations that were made on the previous findings that guided policy and or are still being worked on now, starting with Mushiri, because I see you don't want to talk about results that are not out yet. So let's talk about the ones that was published earlier. Okay, so what are some of the recommendations that came out from that one that have informed policy decision?
Trevor, I would want to request my colleagues. I'm not a demographer.
I think one of the areas that we can all see as Kenyans is the area of mother and child health care.
Okay.
As you can see, like lately, all public hospitals are offering, maternal care for free. So women are encouraged, pregnant women are encouraged to take their children to the hospital so that we reduce issues of maternal mortality, which is the death of a mother during pregnancy or at least 6 weeks after delivery. So we are looking at that, and also the issues of child health. We've seen, the Ministry of Health coming in with policies that are specifically targeting children under 5 years old. Then we're also looking at issues of nutrition of children. And in the DHS, we also do anthropometric measures where we take the weight and the height of the children and the women, so that we're able to see the level of malnutrition, stunting, so that there's intervention in that area. Yes.
What kind of interventions are you recommending?
Nutrition.
Yeah.
Yes.
And this means distribution of food in certain places, because even right now as we speak, there's drought in some places in this country. In fact, there are 23 counties. So what are some of the recommendations you're making that will guide policy then? Yeah, DJ.
I think on basically on policy issues, we also need to understand the mandate of the Bureau.
Yeah.
That first, we get to understand what the situation is all about. From the objectives, we are able then to design the tools that would help us collect the data. We will do that, do analysis, prepare reports, and disseminate that. Now, beyond that, we now have other government organs that would come up with policy-related issues. And what we can measure in the subsequent case is then to see the indicators were like this time. How are they playing out next, the next time that we conduct a similar kind of a study? And so that's when we'll be able to see how well we are faring on. For example, on the issue of the life expectancy in the country. In the census of 2009, male, the life expectancy for male was 58 years, and that of female was 60.8. But then, 10 years down the line, we have noted that life expectancy for males has gone to 60.6%. Years, and then that of female has gone to 66.5. Now, there's great improvement. What does it mean? For us to see such kind of great improvement, it means that there are certain systems that have worked. First, there is the improvement of health, which is keeping people for a longer period of time. There is improvement of nutrition. That is again contributing to that. There is a change of lifestyle, which again is also improving on our length of stay. So we are able now to measure what it was then, what it is now, and the factors, and we know the factors that are contributing to it. So then we are able to tell that Ministry of Health, for example, has dealt with the issue of nutrition to make it to make Kenyans become better and be healthier. In terms of care and treatment, then it means that our hospitals have been more stocked and made more easier for people to get treatment than before. Because that's what we'll be able to explain what we are seeing now. Okay. So at least we can monitor and confirm that policies were put in place around that area of health, and they are working so that people are getting, our lifestyle is getting better, and we have longevity of life beyond what it was 10 years ago, for example, if you have to look at the two censuses. Okay. Yeah, it's, they are really, whatever statistics that we are doing are really related. You get it from the census, you get it from the surveys, you get it from the administrative data.
Yeah, you said that this takes almost 5 months, right? So walk us through the process. So how many households, how is it done?
Okay.
Yeah.
First, I would start by saying that This is the survey in Kenya that has had the largest sample size. In the previous DHS before 2014, we used to have a sample size of 10,000. That means we were interviewing like 10,000, and from that we would be able to get our indicators. But then from the time that health was devolved in 2013, with the coming of devolution, then we need to have indicators being reported at the county level, because that's when those indicators will be useful. Okay. And so that drove us to a sample size of 40,300. That was the largest then. That is 2014. Now, come this year, our sample size has gone to 42,300. Now, what does it mean? We are interviewing in the country. We are interviewing. We expect to interview 42,000 households. 42,300 households. And so within that, we are now able to get indicators that can be reported at the national level and those that can be reported at the county level. Now, again, we are not able to report all the indicators at the county level because there are those cases that are hard to come by. They are not common. Meaning that the variables that we are using to calculate those indicators are not, you are not able to get so many cases if you have a small sample size. And so in this survey, we have designed it in a way that we expect to report 132 indicators at the national level and 72 indicators at the county level, so that we are able to provide each county with reasonable indicators that they are able to use for their planning purposes. Okay. So in terms of maybe it is also good to understand that when we talk of those many households, it is shared by all the counties in a way that each county stands on its own. We are able to analyze the data for each of the 47 counties on their own to produce indicators at that level. Now, this is arising from 1,692 clusters that we are visiting. Now, when I talk of clusters, just consider your village as a cluster or a data collection point. You know, there are details about converting a village into a cluster that we're using. First of all, we start from the preparation for the census, where we come up with the enumeration areas, and then later on, after getting the population in them, like we did in 2019, we use that information now to create what we call clusters, and those clusters are the data collection point. In the old frame, we, as a country, we are developing 10,000 of such clusters, quite elaborate. But for the survey, out of the 10,000, we have sampled 1,692 for the purpose of this survey, where in each cluster we are taking 25 households to respond to the question. And here we are covering the children who are below 5 years. We are concerned about mothers who are within the reproductive age, that is 15 years to 49. And then we are also covering males who are within those particular households. Yeah. So we have a number of tools that we are using to do that. We have the household questionnaire, we have the short questionnaire, and we have the long questionnaire for the purposes of ensuring that we are able to report indicators at the county level and indicators at the national level. Okay. Yes.
So, Mushiri, let me bring you back into this conversation. So, which indicators do you specifically deal with under the macroeconomic statistics?
There are a number of indicators that we deal with. The main one being what you call the gross domestic product. Okay. We look at private consumption. We look at government consumption. We have imports, exports. We quite have a number of them. Yeah. Yes.
And what have been the findings there in the previous one? Because there are quite a number of people who tell me now that when you talk about GDP and there's a bit of growth, but they don't feel it in their pocket.
Okay, maybe it would be important for us to first go to the level of Wanjiko in terms of understanding what GDP is. The full name of GDP is Gross Domestic Product. And actually, when you are doing the GDP, we are looking at the new economic value that has been brought on board. And therefore, you are trying to look to account for what is it that has been created within a year or maybe a quarter in an economy or in a country. And if you go to look at the textbook definition of what gross domestic product is, they define it as the value of goods and services that have been produced in a country in a specified period of time, like 1 year or a quarter. But strictly speaking, when you are looking at gross domestic product, we are looking at the net value. Because if you are a farmer and then you produce 1,000 bags of maize, that 1,000 bags of maize require some input to produce. So as much as the value of that 1,000 bag might be $1 million, the truth is that there must have been some input for you to produce the 1,000 bags. And therefore, when you're looking at the component that creates the GDP, is actually you have to net out what was spent in the process of producing that. Yeah. So the textbook definition of gross domestic product is actually different from the way the national accountants do the compilation of gross domestic product. There are 3 approaches, because we also try to explain when you produce this much, where does it go? So that is the production approach. Then we go to what you call the expenditure approach. Yeah. And you are trying to say, out of what was produced, there is this that was final consumption for the government, final consumption for the private sector. Then there is what we call the non-profit institutions serving households. They are also consuming, like the churches, the NGOs. And then there is part of which that we export. And then we net out what we import. So then from there, we are looking at the income approach. And in the Bureau, we actually do the 3 approaches, because the international recommendation is that you are supposed to balance, because when you do so, then you are not going to be far off from. Remember, these are estimates. Yeah. Nobody can lie to you that their GDP is 100%. Mm-hmm. There is a level of uncertainty.
There's a margin of error then.
There is a margin of error. Okay. And remember that you are also doing it at a time when you don't have all the information at hand. So that's basically the explanation of what gross domestic product is. Okay. Once in a while, you find that we also change the way that we do the gross domestic product. And the reason why we do that, it's at the international level. There is the concepts that we use, they are the definitions, they are the classifications. And one important thing about gross domestic product is that it is used for international comparability. So there is no way as a country you would just decide that we are going to be doing our GDP this way and another country does it differently. So we are to a certain extent limited to observing the international recommendations on how to do the gross domestic product. Okay. So when we say that we don't feel it. Like last year, we reported a growth rate of 7.5. And there are many reasons why one would be justified to say that they don't feel that growth rate of 7.5%. Yeah. One of the reasons is when you're looking at the gross domestic product, like we are in 2022, the number of employees in 2022 is certainly different from the number of employees or the factors of production that we had in 2021. If you look at what we report in our employment figures, there is always an increase. Like last year, we reported an increase of about 700,000 people. These are people that will also be involved in the creation of that GDP. And therefore, when you're sharing the cake, the number of people that are sharing this year will be different from last year. So the cake might be bigger, but then the number of people that are sharing actually more. Mm. So ideally, if you are looking at how the cake has grown, you should actually be looking at the GDP per capita, which we also report in our chapter 2. So if you look at the growth rate of GDP per capita, is actually slower than the GDP we report on table 2.1 of the economic survey. And this is because that is one of the reasons why you don't feel it. Okay. Because when you report 7%, so 7.5%, if you divide it among the Kenyans, then it's actually the GDP per capita growth rate will be smaller than the 7.5%. Okay. Then the other thing is, it also matters where were we involved in the economic activity. If you look at last year, the growth rate for agriculture, forestry, and fishing actually declined by 0.2%. So if you are in agriculture, forestry and fishing, and mostly this was in agriculture, growing of crops and keeping of livestock, they were declined. So those that were in agriculture most probably could not feel the growth as much as those that were probably in something like manufacturing. And therefore, we feel it differently.
Yeah.
If you are in a sector, if you are engaged in an economic activity that was doing well in terms of growth, you will feel it better than somebody who was in an economic activity that was actually declining.
Okay.
And even those that are in agriculture, they didn't feel it the same way. If you look at the performance of something like tea, coffee, they declined. They did not perform well. So if somebody was growing coffee, growing tea, they probably didn't feel the growth as much as somebody who was growing something like potatoes, because if you look at the estimate that we did, potatoes were doing well. And then that is the other reason. Then the other reason is we also need to understand what constitutes the GDP. We have both what we call monetary and non-monetary. Non-monetary is something like if you own a house that you live in, we look at how much does that house contribute to the GDP. Because we simply argue, according to national accountants, is that even if you are not living in that house, you would probably be renting one. And therefore, you cannot consider the one that is rented to be contributing to the GDP, yet the one that is not rented is not contributing to the GDP. Okay. So if the growth rate in terms of the number of residential houses that we had was doing well, yes, it was, but this is not something that you are selling out there. You are living in the same house, and therefore you don't feel it, although in actual sense, there is a growth rate in those non-monetary.
Okay.
Yes.
I'll come back to talk about the imports and exports and how we are looking, but let me bring back Vivian into this. In terms of unemployment, how are we looking?
I think if you can allow me, I would like to further the discussion that my colleague Mushiri has made. Yeah. Because this is a question that keeps on coming up in the lips of many Kenyans. That, oh, you are reporting 7.5, we don't feel it. And I would just want to still go back to the agriculture sector, where it was a negative 0.2. That is, it declined as compared to what was reported the other year. It went further down. And so now the concern here is that 3 areas improved or recorded growth within the agriculture sector, and that is cut flowers, sugarcane, and horticulture. Yeah.
Yes.
Yeah. And now the person, we are all farmers. Somebody is in tea, somebody is in coffee, but the fellow who is in sugarcane farming, that year there was a boom because of reasonable rain that was distributed well over that period, over the 1 year that we're talking about, which is 2021. And so those sugarcane farmers who are able to harvest their cane around that time, they recorded a good boom. But the same farmers who did not have sugarcane to harvest at that time, there was very little to celebrate about. We are the same farmers. I'm in coffee production, but somebody's in cut flower. The cut flower fellow was able to get something. And at times you might find that the cut flowers are actually, majorly it is actually done by farms, not individual, that is establishment or companies. So the companies would be able to make a good kill out of that. But if the salaries of the employees have not improved, they'll still not feel much about it. But the farming corporation is able to make some good kill out of that process. Yeah. So the GDP, the impact of GDP plays out differently to different people depending on our situation. So the average that we are talking of 7.5 is not applicable to all of us. Not all of us will be able to feel it. Just like in exams, a school will report that the mean grade for the school is A-. Yeah. Not everybody has gotten the A-. Some have even gotten better. Some have even got A.
Yeah.
The same analogy is applicable to our GDP that is being reported. Now, there's a fellow who has even gotten a D. Now, that fellow does not have the A minus that is the average. So you see, when others are celebrating, the A people will be celebrating, A minus people will be celebrating, but this fellow with a D will not be celebrating. And if this person was not there, the average would have gone even much higher.
Okay.
You get it? So this is what we need to really understand about the GDP when we talk about it. So that it is clear that it does not play out uniformly.
For everyone.
Yes.
Okay.
Yeah.
That's very well explained. I have to take a quick break. When we come back, I'm going to ask the audience to give their questions and comments in just a bit. Also, there's a bit of questions here on Twitter. I'll post them to my panelists shortly.